Welcome everyone, and thanks for joining to help us kickstart Healthy and Safe Swimming Week. We are live for the next 15 to 20 minutes to answer your questions. I'm Brittany Boehm, your moderator for today, and I'm joined by CDC expert Michelle Hlafsa. She is chief of our Healthy Swimming program here at CDC. Last week, CDC released new data that showed mixed progress in preventing outbreaks linked to pools, hot tubs, and water playgrounds. Today, we're going to talk about some of these findings and also provide tips to avoid getting sick from swimming this summer. Michelle, can you first tell us about some of the key findings from this report?
So big picture, there were almost 500 outbreaks linked to pools, hot tubs or spas, or water playgrounds that were reported to CDC for the years 2000 to 2014. When we looked at outbreaks by individual causes, we saw some outbreaks went up in numbers over the years, some went down, and some stabilized or stayed level.
So what were some of the germs that were causing illness?
Well, the top three causes were germs. There's Cryptosporidium, a parasite that causes diarrhea. There's Legionella, the bacteria that can cause a severe pneumonia known as Legionnaire's disease, and the Pseudomonas, the bacteria that causes skin infections or a rash, and outer ear infection, commonly known as swimmer's ear.
So how do people get those germs from the pool?
So there are different ways to get these germs when swimming in a pool. For example, Cryptosporidium, you get when someone who's infected with crypto for short, going into the pool, having diarrhea in the pool, and then other swimmers, unfortunately, drinking that contaminated water.
What about those other bacteria?
So for Legionella, it's about inhaling vapors or mists or aerosols that contain the bacterium. For Pseudomonas, it's about your skin coming in contact with contaminated water. What we see oftentimes with hot tub rash is the rash will look like the shape of the bathing suit because the bathing suit is holding the contaminated water against the skin. With swimmer's ear, it's just water being, staying in the ear.
Right. Are some people more likely to get these type of diseases than other people?
So young children who haven't been exposed to certain germs before, pregnant women who have an altered immune system, and older people who have an aging immune system, once they get infected, might have more severe symptoms. People with a weakened immune system, if they get crypto, they could have life-threatening symptoms.
Oh, man.
And people who are 50 years of age or older, people who are cancer patients, people who have chronic diseases, particularly chronic lung diseases, or people who have a weakened immune system, they're more likely to get sick when infected with Legionella.
So does chlorine not kill these types of germs in the pool?
Well, at levels that CDC recommends, at levels that most state and local health departments recommend, most germs are killed within minutes. Crypto is a big exception to this. Crypto can survive 4 days in a well-maintained pool.
Wow, what about the other ones?
In and of themselves, Legionella and Pseudomonas are killed within minutes with chlorine, just like most germs. But Legionella and Pseudomonas are really good about creating a biofilm around themselves, or a slimy layer that protects them for chlorine. So if the chlorine level drops, they build this biofilm, they grow on surfaces, and then when the chlorine level comes back up, they're protected from the chlorine.
Is there any way for us to know whether there's biofilm in a pool?
Well, the best way to check it out is to check the wall of the hot tub or the spa where the top of the water meets the wall. If it's slimy, there's a biofilm there, and the pool hasn't, or the hot tub has not been cleaned or scrubbed recently enough.
Gross. I know my family and I are probably going to go swimming a lot this summer. Are there some benefits of swimming that you can talk about?
Well, you just mentioned one. It's a great way to have fun with family and friends, but there's also the opportunity to get some physical activity in. We recommend 2.5 hours at least of physical activity a week, and why not make it water-based and fun?
So let's get practical. What is something we should all be doing before we get into the water?
Before you get into the water, you can, before you even consider getting in the water, don't swim or get into the water, or don't let your kids swim if sick with diarrhea. We don't want to share that with anyone. Check your inspection score before going to a public pool or hot tub or water playground. By public pool, I mean a pool that's not in someone's backyard, where multiple families would go, kind of at a hotel or a water park, or your town pool. Your state or local health department might post the inspection results. on their website, or might require the pool or hot tub to post it at the water side. We check inspection scores before we go out to eat. We should be checking inspection scores before we jump in the water.
Right. What about those little test strips that you can find some places?
Well, that's another step you can do before you get in. Do your own mini inspection. And you take the test strips and you check the chlorine or bromine level before you get in, and the pH. The pH is going to be important because it's going to determine how effective the chlorine or bromine are at killing germs in the water.
Where can you get those strips?
You can go to a pool supply store, a hardware store, a big box store. About 100 of them go for $10.
Interesting.
And, oh, sorry?
Go ahead.
Oh, and I was just going to add to let everyone know what you can do is you dip the strip in the water and then compare the colors on the pads of the strip to the colors on the bottle, and depending upon where the color is, that's what chlorine level or bromine level you have, and that's the pH you have in the water.
Interesting. Seems easy. What about once we're in the pool, in the water? What do we do?
Well, once you're in the water, don't swallow the water you're swimming in. If we have to tell people not to swim with diarrhea, we shouldn't be drinking the water. And as far as parents of young swimmers, they should remember not to put toys in the water that encourage drinking that water. Also, they should be taking their children on bathroom breaks every hour. And if they have a little one that's still in diapers, check that diaper every 30 to 60 minutes and change the diaper away from the water.
Good advice. I have a 5-year-old daughter, and we're going to be doing water playgrounds this summer. Is there any specific advice for water playgrounds?
The most important piece of advice specific to water playgrounds is don't sit on the jets. That is recycled water in many water playgrounds. So what we're basically doing when we sit on jets is we're rinsing off our bottoms, we're rinsing out that diaper, and then sharing that water. So stay off the jets.
Ooh, okay, good advice. So we're going to take some questions live from Facebook right now. Be sure to ask a question online. Our first question comes from Louise. I swim year-round in a public pool. I wear goggles. What other personal protective equipment is there?
I think the most important thing you can do is to do your own inspection before getting in the water, using those pool test strips to make sure the chlorine is where it needs to be, or bromine, and make sure the pH is where it needs to be. That's the most important step you can take before getting in.
Okay, great. And another question from Mary, do we have any recommendation on the best type of test strips to use?
My #1 recommendation with test strips is to follow the manufacturer's directions. Make sure that you hold the test strip the way you're supposed to.
Okay, got it. And we have another one that asks about clothes or bracelets that change color or indicate somehow that the water has been contaminated. Do we have any technology that, do we know of anything like that that has clothing or bracelets that change color based on water contamination?
I wish we did.
Yeah.
But unfortunately, no. I mean, even there's that urban legend that there's a special chemical in the pool that changes color when someone pees in the pool. Unfortunately, that doesn't exist.
Gotcha. Okay. What about like free-living amoeba? Is that ever an issue in swimming pools?
Naegleria fowleri, which is commonly known as a brain-eating amoeba, should not be an issue in a well-maintained pool.
Okay, great. And what about, this is something I always think about, the red eye we get in the pool. What's that from?
A lot of people think that's chlorine, but actually that's chlorine mixed with what we swimmers bring into the water. So if we pee in the water, if we don't shower before we get in the water, we bring stuff into the pool that mixes with chlorine, forms an irritant, and that's actually what's making our eyes red, not the chlorine in and of itself.
Oh, interesting. We have a question from Andrea Nicole. Is it worthwhile to use a test strip in a spray park?
Definitely. Spray parks are where the jets are shooting water up out of the concrete, basically. And when you shoot that water up, you're introducing air into the water, and you're depleting the chlorine or the bromine in the water. So it's harder to maintain the disinfectant level in the water. So I would be especially careful to check the water in there. That, and you also have little kids in the water, and those kids are, bringing their germs into the water, and they're drinking the water. So.
Well, speaking of kids, what do you think about swim diapers? Do they work to prevent some of this illness?
Not exactly. Germs can be slowed down in terms of what swim diapers are able to do. They're able to contain solid poop, within the diaper for a set amount of time.
Right.
But when they've conducted studies looking at swim diapers, within minutes, germs are getting out of those swim diapers. If water's getting in, it's getting out, unfortunately.
Right. Well, what about pee? Is pee just as bad as poop in the water?
Pee brings its own problems, different problems into the pool. So I mentioned earlier when pee mixes with chlorine, it forms an irritant and makes your eyes red. What it's also doing is that it's using up the chlorine that would otherwise kill germs.
Gotcha. Okay. What about if there's like leaves and bugs in the pool? Does that mean that it's not a well-maintained pool, and should we be concerned about that?
My concern with stuff in the water like leaves and bugs would be that the chlorine is being used up. The chlorine is interacting with the leaves and with the bugs, and there's less chlorine to kill germs in the pool.
Right. We have a question from Luis about parts per million of chlorine in pools. What's the safe level for chlorine?
So we at CDC recommend at least 1 part per million free available chlorine in water, and that's the form of the chlorine that kills germs. And we recommend that for pools and for water playgrounds. For hot tubs, we recommend at least 3 parts per million.
Gotcha. Thanks. So what is CDC doing in general to help prevent some of these water-related outbreaks?
So what we've done is we've done studies looking at how we kill cryptosporidium. If the levels that we normally keep chlorine at aren't working, how are we going to prevent crypto from spreading and causing infections and outbreaks? And so we did a study to look at how best to kill crypto, and we found that raising the chlorine level to a much higher level for a really long period of time when there's no swimmers in the water is the best way to deal with it once it's in the water. But of course, the main message is don't swim with diarrhea. Keep it out of the water in the first place.
Gotcha. I know we're talking about disease today, but what about drowning and other injuries? Are there things we should be on the lookout at the pool for preventing drowning?
The best way to prevent drowning is to learn how to swim. And if you're a parent of a young swimmer, stay close to the young swimmer and pay close attention to that young swimmer. Put that phone down. The smartphone can wait till later, the texting and all that, because people drown and they drown quietly and quickly.
Right. What about athlete's foot? Is that ever a problem in pools?
With athlete's foot, I'd be more worried about keeping the flip-flops on in the locker room and while showering.
Got it. How about, are there any tips to not be distracted around the pool?
Like if you're watching
kids,
ones,
yeah.
Oh, get rid of that. Put that smartphone down. I think that's the #1 way. Make sure you're paying close attention to your little one and you're close by.
Gotcha. We have another question from Alexander. Do you know how dirty our local ocean beach is? So any way to determine if your beach is has dirty contaminants in it?
So our ocean beaches should be monitored for their water quality, and some beaches have chosen to post their scores online, much like we post inspections online. If there is something wrong with the water quality, there should be a sign posted on the beach saying, the beach is closed to swimmers due to water quality, or something to that extent.
Gotcha. Are there any policies about, laws or ordinances and where places where people have to shower before going into the pool? Like, are they required to do so, or is it just a recommendation?
It depends on what your community requires. Some communities require signs to be posted. I know at my gym, there's a big sign before you exit the door to the pool area saying you need to shower, and the lifeguards actually send you back into the locker room if you're not wet.
Interesting. Okay. Well, I think we are about done for today. Michelle, I really appreciate you being here. Is there anything else you'd like to tell everyone?
I encourage everyone to go swimming this year, and especially this summer, but just do it in a healthier and safer way.
Thank you so much. Well, thank you all for joining us today and for your great questions. If we didn't get to any of your questions, we'll respond as soon as possible today. Have a healthy and safe summer, everyone.